Hello, my fellow chipmunks. This is ChipmunkSpeaksTM, aka Alura Gonzalez, and today I'll be going over autism awareness as it relates to mental health. Like, comment, and subscribe for more content. April 2nd marks a significant day in the global awareness calendar, Autism Awareness Day. It is a day dedicated to raising awareness about autism spectrum disorder, ASD, and advocating for better understanding, support, and inclusion of individuals on the autism spectrum. While Autism Awareness Day holds a specific focus on autism, it is part of a larger movement that intersects with broader mental health advocacy efforts. Mental health and autism are deeply interconnected, and understanding how they relate can foster a more inclusive and compassionate society. This audio explores the relationship between mental health awareness and autism awareness, the significance of these observances, and how promoting both can positively impact individuals with autism and mental health conditions. Autism spectrum disorder is a developmental condition that affects how individuals perceive and interact with the world. Characterized by challenges in social communication, repetitive behaviors, and a range of sensory sensitivities, autism is considered a spectrum because it encompasses a wide variety of experiences, from highly functional individuals to those who require extensive support. Each person with autism is unique, with different strengths and challenges. The Center for Disease Control and Prevention estimates that 1 in 36 children in the United States is diagnosed with autism, a statistic that underscores the widespread nature of the condition. Symptoms of autism typically appear before the age of 3, and while there is no cure, early intervention can help improve outcomes. Early diagnosis, access to therapies, and support networks are critical for helping individuals with autism develop communication skills, manage sensory sensitivities, and navigate social situations. However, individuals with autism often face significant social and mental health challenges. The social difficulties inherent in autism can lead to feelings of isolation, anxiety, and depression, especially when individuals are not understood or accepted by their peers or society. This is where the importance of Autism Awareness Day comes into play. It serves as a call for greater understanding, support, and inclusion of those on the autism spectrum. Mental health is defined as a person's emotional, psychological, and social well-being. Just as physical health is integral to all individuals' overall health, mental health plays a critical role in our ability to function in daily life, form relationships, and cope with challenges. However, mental health conditions such as anxiety, depression, and schizophrenia often carry a stigma that prevents many from seeking help or even discussing their struggles openly. According to the World Health Organization, mental health disorders affect 1 in 4 people globally, making it one of the leading health challenges of our time. Mental health challenges can affect anyone, regardless of age, race, gender, or socioeconomic status. Yet, individuals with mental health conditions often face discrimination, marginalization, and misunderstanding. Awareness days such as Mental Health Awareness Month, May, or World Mental Health Day, October 10th, are crucial in dispelling myths, reducing stigma, and encouraging people to seek support. Mental health awareness promotes the idea that mental well-being is just as important as physical well-being, and that people who struggle with mental health issues deserve understanding, compassion, and care. These awareness efforts encourage open discussions, increase access to mental health services, and advocate for policies that prioritize mental health resources. Now here's the intersection of autism and mental health. One of the lesser known aspects of autism is the high prevalence of mental health challenges among individuals on the autism spectrum. Research shows that individuals with autism are more likely to experience anxiety, depression, and other mental health conditions compared to the general population. A study published in the Journal of Autism and Developmental Disorders suggests that around 40% of individuals with autism also experience some form of anxiety disorder, and many report feeling socially isolated and misunderstood. This overlap between autism and mental health issues can be attributed to several factors. First, the social challenges that individuals with autism face, such as difficulty interpreting social cues or forming relationships, can lead to feelings of loneliness and anxiety. Second, the sensory sensitivities common in autism, such as an intolerance to loud noises or certain textures, can cause distress and contribute to mental health difficulties. Finally, the societal stigma around both autism and mental health can exacerbate feelings of frustration, hopelessness, and low self-esteem. The significance of Autism Awareness Day is therefore not only to raise awareness about autism itself, but also to highlight the mental health needs of individuals on the spectrum. Advocating for autism awareness is intertwined with the goal of improving mental health outcomes for this population. When society recognizes the complexity of autism, acknowledging both the cognitive and emotional aspects, it becomes more equipped to provide the necessary supports and accommodations. The goal of both mental health awareness and autism awareness is to build a more inclusive, understanding, and supportive society. Autism awareness provides an opportunity to promote these values and encourage acceptance. Activities on Autism Awareness Day may include educational campaigns, media coverage, social media outreach, and events that highlight the lived experiences of individuals with autism. These campaigns help educate the public about the signs, challenges, and potential of those on the spectrum, fostering an environment that is more inclusive and accommodating. For example, autism-friendly spaces such as sensory-friendly movie screenings or autism-inclusive schools offer individuals with autism more opportunity to engage in everyday activities with less stress and more comfort. Mental health initiatives that target both autism and general mental health are also critical. Access to mental health care, whether through counseling, behavior therapy, or medication, can provide individuals with the tools they need to navigate challenges related to their autism or mental health conditions. Schools, workplaces, and communities can play an essential role in supporting these individuals by offering appropriate resources, educational programs, and mental health services. Moreover, both awareness days encourage people to recognize that mental health is not separate from physical health. Mental health conditions, including anxiety and depression, can impact physical well-being and vice versa. The need to integrate care where both physical and mental health are addressed simultaneously is becoming increasingly recognized in both the autism and general healthcare communities. Raising awareness about autism and mental health is not only about one day of observation, but also about creating long-term systemic change. Schools, workplaces, healthcare facilities, and governments must invest in resources to provide better support for individuals on the autism spectrum and those dealing with mental health issues. Education is a key component of this change. By teaching children and adults about mental health and autism from an early age, we can foster understanding and empathy that lasts a lifetime. Teachers and parents play a pivotal role in helping children understand differences, whether they relate to mental health conditions or autism. Inclusion should be the goal for every level, whether it's in classrooms, the workplace, or social settings. Advocacy is also crucial. Policy changes are necessary to ensure better funding for mental health and autism services, better training for professionals, and greater community support. Legislators must prioritize the mental health needs of all individuals, especially those with autism, ensuring that necessary accommodations and resources are available. In conclusion, Mental Health Awareness Day and Autism Awareness Day, though distinct in focus, share a common goal to create a more compassionate and inclusive society. By raising awareness of both mental health issues and autism, we can work to eliminate the stigma and misconceptions that often hinder support for those who need it most. These awareness efforts encourage open discussion, provide education, and advocate for more accessible resources. With increased awareness and understanding, society can move closer to a future where every individual, whether they are on the autism spectrum or struggling with mental health issues, has the opportunity and support they need to thrive. Once again, this is Allura Gonzalez, aka ChipmunkSpeaksTM, and this is Autism Awareness. Thank you and have a great evening, morning, and afternoon.